Thanks, Carrie. And thanks, Lisa, for having us. My name is Terry, and I work for the Voluntary Action Center, which is an umbrella organization. We're actually funded by the state and subcontracted from the Area Agency on Aging from Lackawanna County. And APPRISE really is a fancy word for Medicare counseling. I have a lot of caregivers, usually sons, daughters, taking now care of their parents, calling and saying, I have no idea what Medicare is or what kind of insurance they have. It's very possible they might have a retirement plan, and so they really don't know how it all relates together and how the coordination of benefits goes. Actually, many years ago, there was no Part D. In Medicare, there's Part A, Part B, Part C, and Part D. But Part D, which is the prescription drug plan, did not actually come into effect until May of 2006. So there's many that are, older Medicare beneficiaries who never had a prescription drug plan and never took a prescription drug plan because maybe they just pay for their medications. I mean, you can go to Walmart these days and, if you're on just very common prescriptions, you can get them for like $4 without any prescription drug plan. But the problem is that Medicare has said that even though a prescription drug plan is a voluntary thing, if you don't take it when you were eligible, which means when you were eligible for your Part A and Part B, that they would penalize you 1% of a $34 figure, so it's 34 cents per month for every month that you didn't take it when you were supposed to. Okay, so if you were, if you went on Medicare in 2009 and you never picked up a prescription drug plan, and it's 2014, and that's like what, 60 months? Okay, so I mean, you can kind of do the math. So that would be a penalty on top of a premium for your prescription drug plan, which the least expensive in 2014 this year is $12.60. So, I mean, it may not be a lot, but for some of these people, it is a lot. So now that's kind of bringing me into a little bit more of a scenario. There's subsidy programs within Medicare that help waive these penalties. One is called, one is called Extra Help. It's funded through the Social Security office, and it helps with your prescription drugs. It's income and resource based. And I have pamphlets out on the table, so if you want to take a look at them and see what those income and resources are, to see if any of your people that you take care of might be eligible. If they're eligible for this full benefit, their generic prescriptions will be no more than $2.55, and their brand names no more than $6.35. That's a huge savings for many people that don't know. The other program is the Medicare Savings Program. Now, for most everyone, Part B of Medicare costs $104.90 a month. For some people, income and resource-based is what it's based on. The state will pick up that $104.90 for them. So it's something to check into, because, I mean, most of these people that are on Medicare or that are elderly, or even if they're on Medicare and they're not even 65, or maybe just due to disability, their income is very limited. And so it is hard to make those ends meet. And so $104 back in their check, or even a smaller copay on some prescriptions, means a lot to those people. I just wanted to let you know, I really didn't know. I'm kind of shooting from the hip here, so you have to bear with me. It's hard to know exactly what your needs are. So I'm hoping that you will ask me questions. That way I can direct answers to you that's going to fit you. I don't want to sit here and tell you all about Medicare. Maybe most of you probably know. You know there's A, there's B, and there's C, and D. There's also supplements and additional insurance. Many people get that confused. A supplement is sold by private insurance companies, and they are more comprehensive, and they're a little bit more expensive. but you pay a premium, like it's kind of like our car insurance. You pay a premium and you pay nothing else usually, no copays. Not when you go to the doctor, not when you go to the pharmacy or the hospital, and you know, if you need to have outpatient services done, you usually don't have to pay anything. Additional insurance is like a Medicare Advantage plan. And there's another thing that goes along with this. A lot of people who get into Medicare Advantage plans, Geisinger Gold, Freedom Blues, those are the most common ones in our area. A lot of people, I had a lady say, oh, I threw my Medicare card away. I don't have Medicare, I have Geisinger Gold. Yes, you do have Medicare. You still have Medicare. Medicare behind the scenes pays Geisinger Gold or Freedom Blue, which is like Blue Cross Blue Shield. They pay them to manage their care. So they still do have Medicare. So I just want to, this is short and sweet, but I just want to let you know that whatever questions that you may have specific to Medicare or health insurance, I'd be more than happy to talk with you. Because I don't know what all your needs are, but I would be happy to do any kind of research that you may have to help you out anyway. So thank you very much, and thank you, Lisa.